Is it true that couples can live together? One is HIV positive, the other one is HIV negative? Is it true that if you sleep with someone who is HIV positive, you cannot contact HIV virus? Is it true that there are people who are called carrier and they can never contact HIV and AIDS? These are some of the things that we are going to look at in this video. So guys, if you have not subscribed, subscribe, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. So guys, we are going to talk about HIV and AIDS. So HIV stands for Human Immunodeficiency Virus. HIV infects and destroys cells of your immune system, making it hard to fight for other diseases. When HIV has severely weakened your immunity system, it can lead to acquired immunodeficiency syndrome, that is AIDS. And AIDS is AIDS is the final and the most serious stage of HIV infection. People with AIDS have very low count of certain white blood cells. You know, white blood cells are the ones that help your body to fight against infection and diseases. So someone who is having HIV and who is having AIDS have low count of white blood cells, and they are severely damaged, and their immune system is severely damaged. So they may have additional illness that indicate that they have progressed to AIDS. So without treatment, HIV infection progress or proceed to AIDS, and it is in about 10 years. You might not know. So what is the difference between HIV and AIDS? The difference between HIV and AIDS is that HIV is a virus that weakens your immunity system or immune system. AIDS itself is a condition that happens as a result of HIV infection. When your immune system is severely weakened or damaged, you can't get AIDS if you are not infected with HIV. So thanks to the treatment that slow down the effects of the virus, so that not everyone who is HIV positive can progress or can proceed to AIDS. So, but without treatment, almost all people with HIV will advance to AIDS. What does HIV do to a person? What does to a body? HIV infect white blood cells of your immune system, and they are called CD4 cells. These CD4 cells, or they can be called helper T cells or T cells, and then they destroy the CD4 cell, causing your white blood cells count to drop. And then this will leave you with an immune system that cannot fight off infection, even those that couldn't, even those that would normally make you sick. So HIV initially make you feel sick with the flu-like symptoms, then it can hide in your body for a long time without causing noticeable symptoms. During that time, it slowly destroys the T cells, the helper cells, the white blood cells. When your T cells get very low, or you begin to get certain illness that people with healthy immune system do not get, HIV progressed or proceed to AIDS. So AIDS can cause rapid weight loss, extreme tiredness, mouth or genital ulcer, fever, night sweat, and skin discoloration, and other illness, and often in people living with AIDS can cause additional symptoms. So let's talk about something that is called retrovirus. Retrovirus is a virus that works backward from the way human cells do. So human cells have instruction, that is the DNA. Have you ever heard people talking about the DNA? So that is the the instruction of the human cell. So DNA, they send message. So they send message, that is RNA, to make build block for your body protein. Retrovirus have their instructions written on RNA. When retrovirus invades your cell, it changes its RNA to look like your cell's instruction, that is DNA. Then it cut your cell's DNA and insert its instruction into them. So your cells then act as though the virus instruction are on its own. So HIV is a retrovirus. All viruses invade your cells and then they use their cells machinery to make more copies of themselves. So HIV not only uses your cells to make more of itself, but it also inserts its instructions into your DNA, and then it will make more copies. So maybe you are asking yourself, who does HIV affect? It is a myth that HIV only affects certain people. Anyone can get HIV and AIDS if they are exposed to the virus. Having sex without condom or sharing needles to inject drugs are the most ways that help in spreading the HIV. Some population, we can say that they are statistically more affected by HIV than others, but just know that everyone can get HIV, the virus. So these people who are more susceptible to HIV are people who are identify themselves as gay, bisexual, and men who have sex with men. Certain races, such as people who are black, they are just assume that black people can contact HIV and AIDS because they sometimes black people, they don't reason, they are just ignorant. A lot of people are not exposed. A lot of people are not educated. So you find that some people still in Africa, they don't know the use of condom, and also they don't. Some people in Africa, they don't circumcise men. So you find that black people are more exposed than white people. That is why they say that way. So those who are exchange sex for money, sexual workers, they are more exposed because they sleep with anybody, any person, anything that they get. Those are not the only population impacted by HIV. It is important to consider that the race, they face unique barriers to accessing preventive care. So getting tested and receiving comprehensive treatment will help reduce the spread of HIV and AIDS. Now, let us talk about the symptoms. You can have HIV without having any symptoms. You have to know that. So this is why it is important to get tested even if you don't feel sick. Several times we have tested people who are not even having symptoms and they turn to positive. So it is important you get tested. At least if you are not someone who is who let me say, if you are not a healthcare provider, if you are not someone who is not in relationship, if you are not, let me just say, if you have not pricked yourself with needle, then I don't know where you will get it, because HIV and AIDS, we have specific places that you can get it. If you're not exposed to those things, there is no need of getting tested. But if you have a partner, just know that you are at risk, because you cannot trust human being. You might be faithful and your partner is not faithful. That is the reality. So it is important that someone who is in a relationship must get tested. Someone who is working in hospitals must get tested. Someone who have ever pricked herself with sharp needles must get tested. What are the signs and symptoms? That is what we are talking about. I'm just talking a lot of things, but let us look at the signs and symptoms. Sometimes you have flu-like symptoms when you first get infected, and then these symptoms, the flu-like symptoms might disappear even up to 10 years. You might not know. So there is something that I also wanted to say before I proceed to highlighting these symptoms. Some people usually just assume that people are healthy and they continue having sex with people whom they don't know after doing test. They are self-test. They do self-test at home. Someone can get HIV and AIDS, or someone can get the virus and the symptoms have not started appearing. Yeah, someone might get infected in 3 months, and you go and test that person. The person turned to be negative, but the person has the virus. So HIV can stay in human body for a period of 10 years before the symptoms start manifesting. Yeah, so these are the symptoms that someone might present with: fever every now and again, chills every now and again, fatigue, sore throat, muscle ache, night sweat, rashes, swollen lymph nodes, mouth sores. No, don't say this one is. Yeah. Now, let us look at the stages of HIV and AIDS. We have 3 stages: acute stage, we have chronic stage, or latent stage, and then we have the AIDS stage. Some people, so let's talk about the acute stage, the stage 1, that is acute stage. Some people get flu-like symptoms in this stage. Mouth sores, and 2 after they have been infected with HIV and AIDS. Maybe 1 to 2, 1 to 2 months after they have been infected with HIV and AIDS. These symptoms often go away within a week to a month. To a month, not to a month, to a month. Stage 2, which is chronic stage or clinical stage or latency stage. After the acute stage, you can have HIV for many years without feeling sick. After these flu-like symptoms, the first symptoms is flu-like symptom. It is in acute stage and it goes after 1 to 2 months. 1 to 2 months. And then after that, you come into chronic stage or clinical stage or latency stage. Then this stage, you can have HIV for many years, up to 10 years, approximately 10 years, without having any symptoms. So that is why you are saying it is important to know that you can still spread HIV to others even if you don't feel sick. Stage 3, that is the AIDS. Now you are advanced. Now you have gone to the last stage. AIDS is the most serious stage of HIV infection. In this stage, HIV has severely weakened the immune system, and opportunistic diseases or infection are much more likely to make you sick. Opportunistic infection are one that someone with a healthy immune system could typically fight them off. So when you have advanced to AIDS, this illness take advantage of your weakened immunity. You are more likely to get certain cancer when you have AIDS. These cancers and opportunistic infection together are called AIDS-defined illness. So to be diagnosed with AIDS, you must be infected with HIV virus and have at least one of the following: fewer than 200 CD4 cells per cubic millimeter of blood. I mean, you have 200 CD4. You have 200 CD4 cells and below. And you have those all the opportunistic diseases that can someone have. Or maybe let's say you have an AIDS defined illness. So what are AIDS defined illness? AIDS defined illness are those opportunistic infection, certain cancers and some neurological conditions, and they are include candidiasis of bronchi, esophagus, trachea, or the lungs. We have also chronic intestinal psoriasis. We have also chronic intestinal cryptospondiasis. We have the herpes simplex ulcers. We have the herpes simplex bronchitis. We have HIV wasting syndrome. We have invasive cancer, cervical cancer. That is why you see those people who are infected with HIV, they usually get tested mostly I think after every 6 months. Yeah, when I was in school, that is what we were told, or that is what they used to do according to the guidelines. Tuberculosis, mycobacterium tuberculosis, Kaposi sarcoma, recurrent pneumonia, recurrent salmonella, septicemia, a lot of infections. Yeah. Now, what are the symptoms of AIDS? Symptoms of AIDS can be caused by HIV infection, but many are from illness that take advantage of your weakened immune system. HIV is caused by immunodeficiency. AIDS is caused by immunodeficiency virus. The virus attacks the helper cells of your immune system, leaving it weakened. AIDS is caused by having too few immune cells to fight off your illness. The spread of HIV, I think there is no one who doesn't know how HIV is spread. You can get HIV through blood, semen, vaginal fluid, breast milk, rectal fluid of infected person. People of all sex and sexual orientation can get infected with HIV and spread it. The virus can enter into your body through your mouth, anus, penis, vagina, broken skin. It can get through your skin unless it cannot get through your skin unless you have a cut or a wound. Pregnant people with HIV can also give it to their children through breast milk during delivery. Having sex without condom is also another. Sharing needles is also another way of spreading it. Something that I know you have been asking yourself, this video, I think it is too long, but it's okay. Can you get HIV from kissing? Since HIV is not spread through spit, your saliva doesn't have HIV virus. And if it has, they said the amount is too little that cannot contact or cannot spread the virus. So since HIV it does not spread through spit, kissing is not a common way to infect the other person. In certain situations where other body fluids are shared, such as if both people have open wounds, open sores in their mouth or bleeding gum, there is a chance you could get HIV from deep kissing. I don't know how deep is that, but you can get HIV through deep kissing if you have open wound in your mouth. Touching or hugging someone who has HIV, those are things that cannot cause HIV. Public bathroom, swimming pool, no way. Utensils, bites or bed bites, donating blood. Donating blood, it cannot transmit HIV and AIDS because they usually do thorough screening of that blood before they release it to the public or before they release it to someone so that it can be given to that person. So I don't think. How can I know if I have HIV and AIDS? Sometimes you might not know if you have HIV and AIDS, but you can feel those symptoms. But you know those symptoms, some of them can confuse you with other diseases. So it is also advisable that you go and get tested frequently, at least after every 3 months. Yeah? Let's stop from there so that we talk about something else in related to HIV, because this video is too long. So maybe in the next video I'm going to talk about the history of HIV. How researchers concluded, or what they usually say, what am I saying? What are some of the assumption on how HIV started, on how HIV started. You see, some people say that somebody slept with chimpanzee, or I don't know, monkey. Some people say that HIV was manufactured in the lab. Some people say, I don't know. I will, in the next video, maybe I will talk about the history of HIV and AIDS according to some of the research that are out. But there is no confirmatory, or there are no confirmatory information about how HIV started. We just know HIV is a virus that causes AIDS, and it is a virus that weakens the immunity, and it has a lot of, and it is spread through those things that I've said. And also, there is no cure about HIV and AIDS. With the drugs, your viral load will go to 0, and you cannot infect someone. So when I started this video, I said that it is possible for couples to live with HIV and AIDS. One is positive, one is negative. I will explain that in the next video. I had to explain some of the things in this video so that when we go there, or when you get there, you are able to understand. And also about the carrier, I'm going to talk about it. So things that we are going to talk about in the next video, so that let me tell you, so that you watch the next video. It's about the history of HIV and AIDS, why couples can live with what couples can be. One can live together, one is positive, another one is negative. And also about the carrier that you can have sex with someone and you can she or he cannot get AIDS. I'm going to talk about those ones, guys. Just follow up. This is part 1 of HIV and AIDS.